Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable BLAINE HIGGS. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable BLAINE HIGGS, Premier of New Brunswick. Dr. Russell.
Merci, Bruce. Thank you, Bruce. Good afternoon, everyone. Bonjour. Exactly 5 months ago today, Premier BLAINE HIGGS and I gathered here in this very room to announce New Brunswick's first case of COVID-19. And today, Public Health has confirmed a new case in the Fredericton region. The individual is between 40 and 49 and is self-isolating. And the source of the new case is under investigation, so our public health teams are working diligently. La santé publique signale un nouveau cas de COVID-19. Il s'agit d'une personne entre 40 et 49 ans dans la zone 3, la région de Fredericton, qui est en isolement. Ce nouveau cas fait présentement l'objet d'une enquête. This novel coronavirus has touched us in one form or another, and New Brunswickers have made many sacrifices to maintain their well-being and that of their families. To date, COVID-19 has claimed the lives of 2 New Brunswickers. Each of them was someone who mattered, who loved, and was loved in return. Je présente mes sincères condoléances à tous ceux qui ont perdu un être cher en raison de la COVID-19 ou de toute autre cause durant cette pandémie. Nous avons fait beaucoup de chemin depuis mars et le Nouveau-Brunswick se trouve dans une position bien différente pour répondre à la COVID-19 de celle dans laquelle il était au début de la pandémie. So we've made a lot of progress, and that's really wonderful. And I was saying that I gave my condolences to the family members and loved ones of the 2 lives that were lost as a result of COVID-19. But my condolences are also for those family members and friends who could not travel to be with loved ones before their passing or to travel for other reasons. So I know it's been a challenge for everyone. And all of the hard work that we've done to get to where we are today has not gone unnoticed, and I just want to thank everybody for that. Pour réduire l'impact d'une autre vague possible de COVID-19, la santé publique a passé en revue toutes les phases d'alerte et les mesures associées en fonction des nouvelles connaissances scientifiques et de l'efficacité des mesures de contrôle antérieures mises en place au Canada et dans d'autres pays. To reduce the impact of another possible wave of COVID-19, Public Health has reviewed all alert levels and associated measures in light of new scientific knowledge and of the effectiveness of previous control measures in Canada and other countries. Should we have to move the province or a given region to a different alert level, we are being transparent by unveiling our triggers and revived public health measures so New Brunswickers are prepared and understand what will occur. And part of that was when you impose measures from a public health perspective for risk mitigation, they should really equal the risk at the time. And what we're able to do now, looking back on all the measures that we've used to control and contain COVID-19, we know what's been working, we know what perhaps we can do differently should another wave occur. And we need to work together to manage the virus and ensure the continued economic and social well-being of our province. Les déclencheurs sont liés à 3 domaines principaux que nous devons gérer pour pouvoir contrôler la transmission de la COVID-19 dans notre province. Le premier domaine est l'épidémiologie provinciale. Grâce au tableau de bord auquel vous êtes maintenant très habitués, nous allons suivre de près l'augmentation du nombre de cas. Nos déclencheurs, en ce qui concerne ce domaine, demeurent le nombre de cas, la transmission communautaire et les éclosions dans les milieux vulnérables comme les établissements de soins de longue durée ou les hôpitaux. Le deuxième domaine est notre capacité en matière de santé publique. La capacité de réaliser des tests, de retracer et d'isoler les cas potentiels de COVID-19 est notre principal moyen de contrôle de ce virus. Si jamais nos équipes sont débordées et ne peuvent plus effectuer ces tâches en temps voulu, nous devrons probablement revenir en arrière par étapes pour atténuer le risque de voir le virus nous échapper. Le troisième domaine est la capacité de notre système de santé à faire face au nombre de cas dans les hôpitaux. Si des signes apparaissent indiquant que nous ne sommes plus en mesure de protéger nos travailleurs de santé ou que nos hôpitaux risquent d'être submergés, nous devrons demander l'aide de la population pendant un certain temps. Our triggers are linked to 3 key areas that we need to manage to be able to control the transmission of COVID-19 in our province. The first area is our provincial epidemiology. Through the dashboard in place on the GNB coronavirus website, we will closely monitor increases in case numbers. Our triggers in this area remain cases or community transmission and/or outbreaks in vulnerable settings such as long-term care homes or hospitals. The second area is our public health capacity, the ability to test, trace, and self-isolate potential cases of COVID-19 as our primary means of controlling this virus. If ever our teams become overwhelmed and can no longer do these things in a timely manner, we will likely need to shift back in phases in response to the risk of the virus getting away from us. The third area is our healthcare system's capacity to cope with cases within our hospitals. Should we see signs that we are no longer able to protect our healthcare workers or that hospitals are at risk of being overwhelmed, we will need to ask New Brunswickers for their help for a period of time. In short, anytime one of these triggers is present, our public health team will prepare a risk assessment and bring recommendations to the government as to the next steps we believe are necessary to protect the public. I also want to take a bit of time to speak to some of the changes in our colors. If there is a theme here, it is that we believe that we can be less restrictive should we need to if we once again need to reintroduce population-based measures such as closures or restrictions on gathering. Some of the changes touch on daycares, family bubbles, masks, and physical distancing. One of the major changes is that daycares will remain open under any scenario, using appropriate guidance that has been successful to date in keeping our children and caregivers safe. This will also mean we can ensure that we can also keep our economy going. As always, the decision to remain open would be at the discretion of the daycare operator, but they, like many other sectors today, have a much better understanding of COVID-19 and the measures that can keep everyone safe and healthy. We have also changed our bubbles that will now include formal and informal caregivers and members of immediate family, parents, children, siblings, and grandparents. We do not believe that we need to go back to a place where families are kept away from each other for long periods of time, or where our most vulnerable lose access to their caregivers at times of great need. Je voudrais également prendre un peu de temps pour mentionner certains changements de couleur. Si un thème se dégage ici, c'est que nous pensons pouvoir être moins restrictifs si nous devons réintroduire des mesures visant la population, comme la fermeture de lieux ou les restrictions sur les rassemblements. Certains de ces changements touchent les garderies, les bulles familiales, le port de masques et la distanciation physique. Un des principaux changements porte sur les garderies qui resteront ouvertes en toutes circonstances en suivant les conseils appropriés qui se sont avérés efficaces pour assurer la protection de nos enfants et des personnes qui s'en occupent. Cela signifie également que nous pouvons continuer à soutenir notre économie. Comme toujours, la décision de rester ouvert est laissée à la discrétion de l'exploitant de la garderie, mais comme dans beaucoup d'autres secteurs aujourd'hui, il possède une bien meilleure compréhension de la COVID-19 et des mesures à prendre pour assurer la sécurité et la santé de tous. Nous avons également modifié la composition de la bulle des ménages qui comprend maintenant les aidants formels ou informels et les membres de la famille proche, parents, enfants, frères et sœurs, grands-parents. Nous ne pensons pas avoir de nouveau à faire face à une situation où les membres des familles sont tenus à l'écart les uns les autres pendant des longues périodes où les personnes les plus vulnérables n'ont pas plus accès à les fournisseurs de soins en cas de grands besoins. So although physical distancing should always be 2 meters without a mask, we will now be allowing public spaces to reduce physical distancing down to 1 meter in public spaces with seated venues, as long as a community face mask is worn at all times. Effective Monday, August 17th, this would only be permitted in the yellow and orange phase for those public gatherings with seated venues that are allowed to open. It will allow for some businesses and activities to return to a level of occupancy that will better allow them to operate. Bien que la distanciation physique doive toujours être de 2 mètres sans porter de masque en public, nous allons maintenant permettre que, dans les espaces publics, avec place assise, elle soit réduite à 1 mètre à condition que les gens portent un masque en permanence. À compter du lundi 17 août, cette nouvelle mesure ne sera permise que pendant les phases jaunes et oranges dans les lieux publics avec place assise qui sont autorisés à ouvrir. Et il est toujours nécessaire de maintenir une distanciation physique de 2 mètres lorsque vous consommez de la nourriture ou des boissons puisque vous devez ôter votre masque. Nous devons tous prendre des précautions pour limiter la propagation du virus et permettre à la province de demeurer dans la phase jaune du rétablissement en se protégeant et en protégeant les autres. À partir d'aujourd'hui, je vous propose à tous de faire du jaune notre couleur préférée. Starting today, I suggest we all make yellow our new favorite color. So in closing, I must take this opportunity to recognize the many unsung heroes who have helped support us during this pandemic. I want to say thank you to all the healthcare workers who continue to work hard screening and testing for COVID-19 and treating patients. And though many of us feel we have returned to normal, our hospitals are still on high alert and personal protective equipment is still a part of their day-to-day routine. So to our healthcare workers, you are on the front line of this pandemic and we thank you. À tous les travailleurs de la santé, vous êtes en première ligne de cette pandémie. Nous vous remercions. Je vous remercie pour ce travail et pour les efforts que vous déployez afin de répondre à tous les autres besoins de la population en matière de soins de santé pendant cette nouvelle normalité. I also want to thank first responders, long-term care staff, and others who have continued to go above and beyond help to support our loved ones and ourselves. We have worked tirelessly throughout this pandemic to make sure that New Brunswickers are staying safe. We have many other New Brunswickers to thank as well. So there's many frontline workers as well that we have to thank. So je parle des chauffeurs de camions, du personnel des épiceries, des commis de magasins et des fournisseurs de services qui sont la raison pour laquelle nous pouvons nous tous acheter de la nourriture et des produits de première nécessité. Nous faire couper les cheveux, obtenir des soins dentaires et profiter d'un repas que nous n'avons pas eu à préparer, le tout de façon sécuritaire. I also want to recognize everyone working behind the scenes at our regional health authorities and hospitals, the jewels of our health system, our extramural program, and Ambulance New Brunswick, our First Nations communities, our municipal, provincial, and federal partners, our entrepreneurs and business leaders that have kept going through uncertain times and delivered jobs and essential services for our citizens, our elected leaders. But I also want to save the biggest thanks for last. Mais je voulais garder la plus grande remerciement pour la fin. Merci à tous ceux qui ont adopté les mesures et les lignes directrices de la santé publique et les ont fait leurs. Merci d'avoir intégré dans votre nouvelle normalité le lavage des mains, la distanciation physique, le fait de rester à la maison et de se faire tester si vous tombez malade. Comme nous l'avons déjà mentionné, nous voulons peut-être en finir avec le COVID-19, mais elle n'en a pas fini avec nous. I feel very grateful to be a New Brunswicker at this time. I know we can tackle this challenge together. And to date, we have absolutely flattened this virus together. And as long as we do our part, I have no doubt that we will continue to do so, even with challenges and uncertainties ahead of us. So let's stay vigilant, let's stay collaborative and cooperative and engaged, and continue to do all of this work together. Un gros merci.
Bonjour, good afternoon. We don't have to look far to see reminders that COVID-19 is still with us. This This is a fact that we have understood since the pandemic began, and it is something we have taken into consideration as we have looked at how New Brunswick can best move forward while keeping residents healthy and safe. As with any challenge, the more information we have available, the better we know what steps to take. Cette pandémie a été une courbe d'apprentissage depuis le début, et elle va continuer de l'être. Alors que l'automne approche, que les écoles vont ouvrir et que le plus grand nombre de personnes vont retourner au travail dans notre province, nous avons pu examiner ce qui a bien fonctionné. Nous avons également pu examiner comment ces renseignements peuvent être utilisés pour guider nos décisions futures. One thing we can all agree on is that we never again want to have to shut down our province like we had to this past spring. Faced with the facts we had, it was the best decision we could make at the time. While it was tough on everyone, it was the right thing to do, and it has given us a better understanding of how we can avoid that necessity going forward. We have looked to the science, spoken with public health, and together have determined what situations would trigger different levels of response. Dr. Russell has provided details on the triggers and how we are now categorizing the different levels of recovery. You can be assured that we have made these decisions to ensure any new challenges we face due to COVID-19 will have the least impact on New Brunswickers and the economy of our province, while still keeping everyone as healthy and safe as possible. Ideally, we need to stay in the yellow level of recovery. For this to happen, we must all work together. Nous devrons tous suivre les directives de la santé publique et prendre toutes les mesures nécessaires pour nous protéger et pour protéger les autres. C'est le seul moyen pour que ce plan fonctionne, si tout le monde travaille ensemble. I understand that people have concerns as restrictions are eased and life returns to a new normal. But it is imperative that we resume our lives and get back to work and restart schools. We need to continue to support local businesses and strengthen our economy. It is equally imperative that we do all of this mindfully, remembering to take the simple but necessary steps to keep all of us healthy and safe. With the great summer weather, we have witnessed more gatherings and have noted that people aren't always following the rules. By doing this, we are putting our fellow New Brunswickers at risk. We must and we can do better. We need to be prepared for a second wave of the virus, but let's not create it through poor behavior. En respectant les directives de la santé publique ainsi que l'ordonnance d'urgence, nous pouvons garder notre économie ouverte et éviter un retour à des règles restrictives. Jusqu'à maintenant, le Nouveau-Brunswick a obtenu de succès à ce chapitre et tout le monde devrait être fier de ce que nous avons accompli. In so many ways, our province has been a leader, and we can continue to be one as we move into the next phase of recovery. According to the labor stats for July, released by Stats Canada on August 7th, employment in New Brunswick was at 96.6% of its pre-COVID February level, the most complete employment recovery of all provinces to date. As well, according to a survey released on August 5th by the Canadian Federation of Independent Businesses, 70% of New Brunswick respondents said their businesses are fully open, compared to 63% across Canada. Respondents also indicated that 40% of New Brunswick businesses are operating with the usual staffing levels for this time of year, compared to 35% across Canada. A further 5% of New Brunswick businesses reported operating with more staff than usual for this time of year, compared with 4% across Canada. La situation va continuer de s'améliorer au cours des prochains jours, et ce, aussi longtemps que tout le monde fait sa part d'effort pour garder le Nouveau-Brunswick dans la phase jaune. En travaillant ensemble, nous serons prêts à relever les défis que pourraient se présenter si le Nouveau-Brunswick était confronté à une deuxième vague de ce virus. Working together, we can control the spread of COVID-19, and we can ensure the continued economic and social well-being of our province. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre, Dr. Russell. Thank you, Dr. Russell and Premier Higgs. We will now proceed to questions from the media. You have the right to pose your questions in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Mike Cameron, CTV.
Thanks, Bruce. This is for Dr. Russell. In the past couple of weeks, Doctor, there have been significant outbreaks in other parts of Canada, especially Western Canada. When you look at those, do you see any implications for New Brunswick? Do you see any cause to rethink some of the easing of restrictions, even some of the changes in policy you just announced a few moments ago? Or does it cause you to second guess some of that we may have reopened too quickly when you see what's happened in other parts of the country and how fast it's happened? Thank you.
I think that the fact that there are outbreaks in other jurisdictions in Canada and outside of Canada just speaks to the fact that this pandemic will be with us for a very long time. We will continue to see things ebb and flow with respect to outbreaks, and our efforts to contain those outbreaks will continue to be the main focus of the work that we have to do during this pandemic, notwithstanding the fact that we know that earlier strict measures have had very negative consequences, negative impacts on people's mental health and on the economy. So it's a balance of all of those pieces of information, the evidence-based information that continues to come out from the Public Health Agency of Canada, and the continual sharing of that information and discussing of that information at the national level with my colleagues across the country. And so we continue to take all of this information in while we move forward. So I wouldn't say that I'm overly concerned in the sense that it's expected that we will continue to see ebbs and flows in the number of cases and outbreaks across the country, including in New Brunswick. So I don't think there's anybody that feels that the risk in New Brunswick is zero right now, nor will it ever be zero. So the more cooperation we can have with individuals, continue to follow public health directions, working with the policies that are in place, and as we move forward, we will continue to reevaluate our decisions as we have done throughout the pandemic. So there is no point in time where things are fixed or in a static state. We will continue to evaluate and take that information into account as we move forward. And so I think right now we can look back at what we accomplished to date and say that's great, but as in other jurisdictions that have done well, nobody feels that we can move forward without continuing to to be vigilant and to continue to be as cautious as we possibly can be in the context of balancing all of the risks and balancing all of the information that we have.
Thank you, Doctor. Mr. Cameron, do you have a follow-up today?
I wonder if I could ask the Premier a quick question. If the Premier could update us on the status of any talks to reopen the border, New Brunswick's border with the rest of Canada. Are you engaged in any talks with Quebec and Ontario? Is that a possibility this summer, or is that more likely a fall or winter thing if it happens at all?
There aren't any current talks in that regard. There's some, I'll be having some, meetings in the near future in terms of the Atlantic bubble and how that is working and continues to work. In terms of the federal government, certainly there isn't any plan to open the U.S. side of it till the 21st. And then that may not happen and may get delayed further. I think there's a good possibility of that. And in terms of the rest of the country, I think the very points you raised earlier with Dr. Russell about the outbreaks would not lend us to be anxious to open up the rest of the country. I mean, I'll continue to talk with my colleagues, but obviously most importantly with public health about the reasonableness of doing that and the exposure in doing that and the risk reward as part of it.
Thank you, Premier. Thank you, Mr. Cameron. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, in the St. Croix riding, we are anticipating going to the polls for a by-election in the near future. Can you give voters an idea of what that will look like, what precautions will be added during a pandemic, and when do you expect to call a by-election?
Well, the rules around the actual election would be certainly set by Elections New Brunswick and following the health guidelines set by Public Health. So I think that what people can expect is in relation to what they do every day when they go to a grocery store or they go to a service NB or they go to any activity, is that in the COVID world, we have to respect the social distancing or wearing masks and protective equipment, or, and the washing your hands. All of the protocol that has been put in place over the past several months will have to be exercised during an election process. I feel that, when you look across the system right now, we'd like to think we're in a lull. We think we're in a permanent lull as related to the COVID cases, but we're all bracing for a second wave, and certainly it will be important that the election process is done very, very effectively and appropriately. I know that we are certainly doing that internally through any of the nominations we've had thus far. We've been very cognizant of the protocols that must be followed. Elections in New Brunswick, I'm sure, will ensure that same thing is followed for any elections.
Thank you, Premier. Ms. Hogarth, do you have a follow-up today?
Just a quick follow-up. Premier Higgs, do you know when you expect to call a by-election?
I haven't set a date, but we have agreement with the other parties that we would do so before or not after October 15th. It will kind of depend on the fall setting, and it will depend on the outcome of the discussions being held this week, because, it very likely, if those are not successful, that is our plan, that we can work together, but we'll see where that goes. So there's a lot of factors that are hinging into by-elections versus a general election.
Thank you, Premier. Thank you, Ms. Hogarth. Bobby Jean McKinnon, CBC.
Yes, thank you. Premier Higgs, you say there's been large gatherings this summer and that we must and can do better, but there is a section of the state of emergency order that prohibits large gatherings. So when the government finds out about these gatherings, why aren't officials investigating instead of saying they need someone to complain first?
Well, you're correct. I mean, our system does rely a lot on the complaint space, but we are aware, we've all seen pictures on social media, large gatherings, whether it be on the beachfronts and or in other public areas. I think what we've said from the very beginning is, although we have police presence, although we have public safety officers present, it's extremely important that people use their common sense. We've seen in big gatherings, large gatherings in big cities across our country, in the U.S., we've seen what this has done in an outbreak. Dr. Russell referred to this today about, looking at across the country, but looking at in relation to us opening up. So we're trying to be a province that opens up safely, but opens up in a way that allows our economy to recover, allows people to get back to normal and stay normal in the COVID days as much as possible. And what can put that all in jeopardy is an afternoon on the beach with 1,000 other people, and somebody that for whatever reason had a contact with COVID, and the way it goes. So we cannot take this for granted. We cannot be complacent, and that is going to be our downfall. And if we expect that the police are going to be able to watch all of these public gatherings and parties throughout our province, especially in the great weather we've had, it'll never happen. So if one thinks, oh, well, I got away with it, if you infected your grandfather or your grandmother or your parents, they might not get away with it.
Thank you, Premier. Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. David Kuhn says he won't sign on to your deal. Do you need all three opposition parties to sign on to avoid an election, or would 2 out of 3 be enough?
Well, certainly the goal is that we would have agreement in the House, and we have 4 parties represented in the House. And I haven't read the details of his public announcement in that regard, but it's a little disappointing that before the meetings ever start, that someone declares the outcome. I mean, I'm going into this with the idea that we can develop a path forward, that the province will be the winner. But I'm also going in with the idea that the possibility exists that may not happen. And I guess Mr. Kuhn has indicated that he's first off the plate, suggesting that might not happen.
Thank you, Premier. Thank you, Ms. McKinnon. François Leblanc, Radio-Canada.
Oui, bonjour. La question pour Dr. Russell. la Ligue de hockey junior majeur du Québec a affirmé là, que le Nouveau-Brunswick avait accepté là, son protocole pour recommencer pour un retour au jeu, pour commencer à jouer. Les camps d'entraînement commenceraient dans 2 semaines. Je veux juste savoir quelles sont les raisons pour lesquelles vous avez accepté le protocole de la Ligue, puis qu'est-ce qu'il reste à faire au niveau des équipes pour être capable de commencer cette saison et les camps d'entraînement.
Alors, pour les équipes de hockey dans la Ligue de Québec, leur plan a été présenté pour notre équipe à santé publique. Alors, notre équipe a vu le plan et à cause de l'information qui était contenue dans leur plan, on l'a accepté, sauf que je crois que les prochaines étapes, c'est pour vérifier avec les établissements, les arénas, pour faire certaine que tous les plans qui sont acceptés par santé publique pourraient être opérationnalisés par les établissements comme les arénas. Mais comme
Est-ce que ça veut dire, eux autres demandaient d'avoir 250 spectateurs par aréna pour des matchs. Est-ce qu'à ce moment-là, ça veut dire qu'on pourrait avoir des arénas qui n'auraient pas 250, qu'il y en a qui pourraient se faire permettre de recevoir plus?
Ça dépend sur la distanciation physique puis la manière qu'ils vont être capables de suivre les directions dans le plan au niveau des directions de santé publique. Mais toutefois, ça veut dire aussi que s'il y a quelque chose qui arrive, il faut qu'on reverse et on va en arrière à la phase orange ou rouge, ça va éliminer la chance de jouer après ça. Et les équipes et les établissements sont tous en train de fournir leur propre plan.
Merci, Docteur. Monsieur Leblanc, as-tu suivi cet après-midi?
Oui, j'aimerais savoir, au niveau du sport un peu plus en général à ce moment-là, est-ce qu'il y a d'autres organisations sportives qui vous ont fait des demandes pour ou vous ont présenté des plans opérationnels, là, je pense au hockey junior des maritimes, au sport universitaire, là, que ce soit le cross-country ou encore le soccer ou le hockey?
Spécifiquement pour un plus grand événement, oui, on a reçu un plan pour un événement pour le curling au niveau national en préparation pour les Olympiques.
Merci, Docteur. Merci, Monsieur Leblanc. Michael Tutton, Canadian Press.
Good afternoon, Premier. Are you keeping your options open to call a fall election if you do not have an agreement by Friday?
Absolutely.
Thank you, Premier. Mr. Tutton, do you have a follow-up?
Premier, could you tell us why you would consider an election at this time if you don't have an agreement by Friday?
So I've said that we want stability going forward. We don't know where the second outbreak may come from and when. We believe right now we do have a lull in our province, as indicated by the current number of cases and their ability to track these cases. Going forward, our economic recovery needs to be on a methodical path. We need to have stability in how we approach the recovery. We know that there's going to be tough times ahead. We know that there's going to be issues that are related to, companies being able to start up and what does it look like across our country as we try to expand into other, get back on our program of economic recovery. So at this stage, we have a window. And we have a window to decide whether we can map out a future together and put our priority as a province and put our priority on putting our province back on a road to recovery and responsibility. And we can provide that to the people of this province. So this window isn't something that will last for a long period of time. We don't know. But right now, we know there is a window. And so that's why the timelines are set. That's why we're focused to see if we can find an agreement going forward. And unfortunately, early indications would say that that may be difficult.
Thank you, Premier. Thank you, Mr. Tutton. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. Bruce, s'il te plaît, laisse-moi savoir quand il peut entendre la traduction.
Donne-moi 2 secondes. Vas-y.
All right. Donc, actuellement, les personnes qui passent la frontière avec la Gaspésie doivent s'enregistrer en ligne et attendre une autorisation Est-ce que vous êtes ouvert à permettre aux gens de franchir la frontière seulement avec une pièce d'identité avec photo, comme un permis de conduire, par exemple?
Well, at this time, you know, we're quite pleased with how the program has been followed, what we see in terms of results and having a period of time to measure those results. I'll wait for a recommendation from Public Safety and Public Health on what next steps might look like. But I would think at this stage, you know, there were a lot of concerns in the rest of part of the province about doing so. I'm pleased that so far it looks like we're able to manage that. We felt that we had that possibility, public safety, and the many folks that Dr. Russell, you know, thanked as part of our program have put a procedure in place that's working. So I don't see a reason to change that right now in terms of how we identify people. If there are other restrictions that we can lift or move in the direction, we'll work with Public Safety and Public Health to determine that.
Merci, M. le Premier. M. Boudreau, as-tu un suivi?
Oui, il y a des personnes dans le Nord qui se plaignent que le processus pour passer la frontière prend trop de temps. Est-ce que vous regardez à d'autres options pour accélérer ce processus-là?
Peux-tu le répéter encore une fois, s'il vous plaît?
Oui, il y a des personnes qui se plaignent que le fait de passer la frontière prend trop de temps. Je me demande si vous regardez à d'autres options pour accélérer ce processus-là.
Well, thank you for the question and repeat it for me. In relation to the timeline, I'll look into that to see what the timelines are. I've asked the question very recently, certainly in preparation for today's press conference, but also in the last couple of days, how's it going in the north and how's the movement? I've been told it's been going well, but I will look into those delays. I mean, what does long look like? I mean, is it minutes? Is it half an hour? Is it an hour? But I will endeavor to understand exactly, is there an issue there that we can improve upon?
Merci, M. Boudreau. Merci, M. le Premier ministre. Silas Brown, Global TV.
Hi, Premier. It appears as if Clinic 554 in Fredericton, in concert with a legal firm based in Ontario, I believe, are preparing the groundwork for a class action lawsuit regarding abortion access in the province. I'm wondering what your thoughts are on that.
Well, certainly, I mean, that's the advantage of living in Canada. I mean, if someone feels that we are not following the rules of the Canada Health Act, in this case, then they have every right to bring it to a legal matter and make it a legal matter and challenge it. We certainly have asked that same question in relation to our bill, what we're doing in following the Canada Health Act, and we have been given the advice that we indeed are doing just that. So we're very comfortable in our position. We will continue to follow the Canada Health Act. We believe that certainly abortion services in our province are available, accessible. We believe in this particular case with the clinic that the abortion bill has played quite a role in the current demand and usage, and that's played quite a role in maybe the viability of the clinic itself. But that's a separate issue. The issue is, can we provide services that are required and necessary in our province, and are we following the Canada Health rules in doing so? And we believe that yes, indeed, we are.
Thank you, Premier. Mr. Brown, do you have a follow-up today?
Yes, I do. So I was able to speak with the Federal Department of Health earlier today, and they say that likely next year they will begin levying penalties based upon the amount that people are being billed for out-of-hospital abortions, unless New Brunswick moves to fund those out-of-hospital abortions. Would any of those penalties change your approach to funding abortions in the province, or are you committed to standing firm with how access is as it is currently?
So here's my situation in relation to penalties. So we have a legal system, and we have a process in a democratic society that's governed by rules and regulations, that if anyone is not following those rules, we have a process to challenge, have an independent assessment and a ruling come forward on what are the right next steps. So if a federal government decides that I will put my own penalty in place, regardless of the rules of the land, and I'll basically force my hand on a province because I think I can, is that our democratic society? Is that what we cherish here in our country? That is not the system. A federal government should not be dictating to a province. They should apply the laws of the land. We feel we are following the rules and laws. If that's challenged and it's determined that we're not, we will certainly correct that. But as far as someone trying to hold me ransom and dictate through a non-democratic or non-legal process, I have great difficulty with that.
Sorry, Premier, are you suggesting that the federal government should not be allowed to levy penalties under the Canada Health Act if they believe that a certain jurisdiction is not meeting their obligations?
They have the right to use the court system to challenge whether we're following the Canada Health Act or whether we're not. That is the process. To arbitrarily institute penalties is not the process. That is not a decision for me to make or for the federal government to make. The courts will decide if we are following the Canada Health rules. And we're saying we are because we don't fund private clinics. Because this is a slippery slope. This is something that, then where do you go from there? How many other private clinics are we going to fund in a public healthcare system? I mean, is that where our health system is going? So it's a bigger question. That has been our contention all along. There is a system, a mechanism to resolve it if the federal government so choose, but to choose something arbitrarily and try to make it a funding issue that they would leverage upon us, that is not the process that's clearly defined in how you finalize decisions or determine the rules and regulations.
Thank you, Mr. Brown. Thank you, Premier. Savannah Odd, Telegraph Journal.
Hi. So first of all, I wanted to ask on the phase changes. We've been told that we got it right in New Brunswick in the first wave because we had pretty strict rules and we put them in place early on. What is your response to critics who, with this news, might feel that there's a bit of an explicit trade-off favoring the economy over public health?
Hi, Savannah. So when we looked at the effects of the first wave in terms of the measures that we imposed, we certainly had many conversations, again, at the national level with our counterparts across the country, Public Health Agency of Canada, all the evidence-based information that we had at our disposal at that time. So the decisions were based on information we had at that time. And certainly the evolution of our approach has really become more focused on the social determinants of health as we move forward. I think, as I mentioned during my speech, that early on well, actually, probably, sorry, I didn't mention it today, but in other speeches, I have mentioned the fact that early on, our main focus and our main goal really was about containment, about protecting the healthcare system, about making sure that we had enough, had access to enough to enough beds, ICU beds, ventilators, et cetera. And I think that globally that seemed to be the approach around the world. Learning from the first wave and learning from the experiences that we've gone through and looking back on those and looking at new information from an evidence-based perspective and putting that together with a lens of the social determinants of health, looking at the negative impacts, the unintended consequences, the quantification of all of that, when you balance that against the risks, is difficult to put a price on it, to put a value on it. But we do know that those negative effects and unintended consequences did occur with respect to mental health, et cetera. So it's not to say that one is more important than the other. When you look at the social determinants of health, they're all important. So where people live, where people work, how much money they earn, the security and stability of their environment, et cetera, all of these are equally important and contribute to a certain percentage of a person's overall health. So moving forward, taking into account the social determinants of health, we have to factor in all of these things. And I think with the first wave, we didn't necessarily have the luxury to do that because in the state that things were evolving early on, again, we had to base our decisions on information that we had in real time, which we will continue to do. But the advantage we have now is we can look back over our own responses in Canada and in New Brunswick, and also globally, what's been working, what hasn't been working. And so I think that we are in a good position right now, being in the yellow phase, to take into account all of that information while we continue to stay in the yellow phase and not simply survive in the yellow phase, but thrive as a province in the yellow phase.
Thank you, Doctor. Ms. Odd, do you have a follow-up?
Yes, thanks, Bruce. So in addition to less restrictive phases, as you announced today, in a second wave, can we expect to see a less restrictive approach to our border strategy? For example, do you think cutting off travel between provinces will still be necessary in the second wave?
Hi, Savannah. So the Premier did allude to the fact that at the national level, those decisions are being made around the border, the international borders. And again, those discussions are ongoing from the public health side of things and from the political side of things, and we're continuing to examine what the risks are and benefits around the border measures that are in place at the national and international level. With respect to New Brunswick and opening up the borders to the rest of Canada, again, we have data that comes out on a daily basis. We also have data where we can look at trends over a week, over a 2-week period, and we'll continue to look at that data as we move forward and take that into account when we have our discussions about whether to open up to the rest of Canada at this point in time. We do have, again, information around essential travelers coming in and out of the province, collecting that data, collecting that information, and I think, again, time will tell. We do have some more changes coming in the fall with school and university openings, and we want to be able to focus very positively on those situations and provide information to folks moving forward. But again, this is an evolving situation. We don't expect things to be in a static state or a status quo moving forward. We expect to continually evolve as things unroll.
Thank you, Doctor. Thank you, Ms. Odd. Will Denette-Paul, Radio-Canada.
Bonjour, merci beaucoup. Ma question, je crois que ça va être pour le Premier ministre.
OK, vas-y.
Alors, Monsieur Higgs, j'aimerais juste savoir qu'est-ce qu'il faudrait de manière précise pour ouvrir les frontières avec tout le Québec ou avec le reste du Canada. Est-ce qu'il faudrait, par exemple, un certain nombre de cas de COVID-19 au Québec? Alors, le gouvernement peut-il nous dire à quoi s'attend-il concrètement pour ouvrir avec le reste du Canada cette frontière?
So I think this could be a question, obviously for myself or Dr. Russell, but in my view right now, we have an Atlantic bubble that we're working closely with our colleagues in Atlantic Canada. And we've seen through the public have very much appreciated that cooperative effort and appreciated the ability to move freely within our Atlantic bubble. Opening up just to the community, the borderline communities in Quebec, we're part of an ongoing discussion and some angst around that. The success of that will help determine where we go next. But my next discussion would be, in terms of my end of it, would be with my colleagues, how do they feel and when are they ready? So even though 2 weeks ago we had those very discussions, there was not a willingness to open up the rest of Atlantic Canada with the rest of the country. And I don't know that that's changed anything in the last while, and we're going through our change in the north. So I'll have those discussions. We will determine. I guess we'd want to see trends coming down, not rising. We've pointed out that as Dr. Russell did today, there's 2-3 provinces that are increasing in numbers. Well, certainly that's a trend that you don't want to see happening. You want to see it coming down, and that trend being kind of a continuous one. And the argument can be discussed about, well, do you look at some provinces, not others? Well, that makes it more difficult too to actually monitor and control. So right now we're focused on doing our further openings collectively with our other Atlantic provinces. And at this point, it's been quite overwhelming, the support to continue as we are with limited changes in what we're doing internally.
Thank you, Premier. Madame Paul, as-tu une autre question?
Oui, merci beaucoup, Bruce. Alors, je crois que ma question, la deuxième, va être pour Dr. Russell. Bonjour, Dr. Russell. J'aimerais savoir au sujet de l'équipement, entre autres de l'équipement de protection personnelle, comment la province se prépare à une possible deuxième vague de la COVID-19. Est-ce qu'il y a du matériel qui est stocké, par exemple, des masques, comme blouses, gants, etc. Alors, comment la province se prépare et envisage la deuxième vague?
Alors, vraiment tôt dans nos activités pour gérer le COVID, il y a un groupe de travail qui est responsable de voir qu'on a l'équipement protectif qu'on a besoin chaque semaine, chaque 2 semaines, chaque 4 semaines. Alors, on peut prévenir combien qu'on va utiliser. C'est vraiment quelque chose qui est très détaillé au niveau de l'équipement qu'on a comme tel aujourd'hui et commander, procurer plus d'équipements dans les prochains mois. Alors, c'est un système qui est établi maintenant et au fur et à mesure qu'on aura besoin de d'autres équipements, il y a un mécanisme, un processus pour être sûr qu'on aura l'équipement qu'on a besoin. Et c'est quelque chose que, comme je dis, c'est très détaillé au niveau de la manière que l'information est toute mise ensemble.
Merci, Docteur. Merci, Madame Paul. Adam Harris, Telegraph Journal.
Thanks, Bruce. Question for Premier Higgs on your election proposal to the other parties. You were asked this, but I just want some clarity here. Do you need agreement from all parties, or is the agreement of the Liberal Party enough because of their seat count?
I need agreement from all parties. I believe that, you know, we've seen the Liberals in the past positions change quite dramatically. I mean, I think in the last 6 months, even at the height of this pandemic, basically they were positioning to be in an election mode, and that we were just moving into it. That was the time of the budget passing. So I would suggest that the purpose of having this proposal put forward is to get stability in our province, and to have that stability in moving forward, we need to have assurances that as things get more difficult, which if there's a second wave, if there are other issues, I'm not looking over my shoulder through the entire process. My focus is on keeping New Brunswickers safe and moving our economy in a forward direction, not being on hold and idle during a pandemic, but learning to work and live with it. And that means every phase of what we do normally. And that's my goal. And this proposal is, I would say, very unique certainly in the British parliamentary system. It can be groundbreaking, as has been our COVID team in the past 5-6 months. But we need general agreement in order for it to be successful.
Thank you, Premier. Mr. Harris, do you have a quick follow-up?
Yes, please. So then, Premier Higgs, under your proposal, how would your government be scrutinized for the next 2 years? Aren't you effectively eliminating the opposition by having them agree with you?
So it'll depend, I guess, to the extent of the discussions we have. We are in a unique point in time in history. I mean, I don't think anyone is going to deny that. The agreement says that we would be in this sort of agreement mode while we're in a pandemic until it was officially declared over, or the election mandate is over. So there is a defined period, but it is based on the fact that we have a unique point in history. This situation that we've managed through COVID, you know, we've worked together to get results. The results that I'd be looking for would be very well defined in how we can move the province forward, and with some, you know, obviously some guidelines around what we can do and we can't do together. It's not open-ended, but it is a commitment, and that's what will be required.
Thank you. Thank you, Mr. Harris. Thank you, Premier. Mathieu Bois-Comeau, l'Acadie Nouvelle.
Ma question est pour le Premier ministre Higgs. Monsieur Higgs, dans votre lettre à Monsieur Vickers concernant l'entente pour éviter des élections, vous demandez une entente jusqu'en septembre 2020.